It's me. I'm both a pediatric and adult provider and co-direct, thanks so much, Tim, of Got Transition with Peggy McManus. And you've heard from Samitha Alongo earlier, I think in April. She's also a part of our team. Next slide just tells you I don't have any, let's see. There you go. I have no disclosures, except for to thank you so much for paying your taxes, because obviously it's your taxes that support the National Center. Next slide. So what are we going to do this afternoon is really review some of the Got Transition resources. I'll start with a video and the infographic. You may have seen these before, but I also picked some that are very popular on our website. So people are really looking at this. Then I'll follow up with Samitha Alongo's school-based tools, what we've done with them, with the School-Based Health Alliance, and then the two new toolkits that you see here. And then I always get a question of how can I customize your tools? They're all free, and we want to encourage people to use them. So next slide. So we'll play the Got Transition. This was done with the Patch Group. So why don't you go ahead and play that, Tim? I know he's got to do all this stuff, so I'm impressed.
Questions can pop up anytime, even when it's late. When you need solutions to your homework problems, think of Bartleby.
For many young adults, transitioning to adulthood can mean going to college, finding a job, or moving out on your own. This can be exciting, but also really challenging. One transition that you may not have thought about is healthcare transition, or HCT, which means moving to an adult model of care where you are the main person in charge of your health. HCT is not a single event. It's a process that can take several years. Learning about your own medical history is the first important step. So ask your doctor how to access your health information. A major part of HCT is learning to manage your own health and healthcare. To start, you can make your own doctor's appointments, fill your own prescriptions, and talk with your doctor alone. After you turn 18, your doctor can only legally talk to you about your health. Your health information and medical records will be kept confidential. It is up to you to make your own health choices. You can decide, for example, if you want your parents to see your records or be in the doctor's appointment with you. For those who see a pediatrician, HCT also means moving from your pediatrician to an adult doctor. This usually happens between the ages of 18 and 22. Some people see a family physician or a doctor who sees patients throughout their life. If you see a family physician, you'll need to change who makes your health decisions, but not your doctor. In an adult model of care, you, and not your parents or caregivers, are in charge of making decisions about your own health. To plan for this transition, talk to your doctor and ask them about their policies. If you see a pediatrician, ask them when you need to leave their practice. You can also ask them to help you find a new adult doctor to move to. HCT is all about independence and empowerment, so be proactive. Find an adult doctor who is accepting young adults into their practice and takes your insurance. And don't forget to encourage your friends to be proactive about their healthcare transition too. For tips and resources to make your healthcare transition as smooth as possible, go to gottransition.org.
Great, thanks.
Healthcare transition, or HCT, is about moving to an adult model of care where you would...
Whoops. Well, the other piece, while he's getting us back to the slide deck here, is this infographic. You can see here, it's small, but you can certainly download it. And it just really goes through what is healthcare transition, what transition topic should you think about, what questions should you ask your doctor, What are the differences between pediatric and adult healthcare? And do you have an individual education plan? So this is you can click through this and get that information. The Got Transition video is going to be available in Spanish, as is this infographic. And both have been extremely popular on our website. Many people just have a barcode and it goes right to sending people to this video in clinics when you're beginning to talk about it in general. So I'll go to the next slide. So the next area I wanted to just update you on is that you saw the tools that Samitha went over and for special ed the last time I think she was talking with you. What we've since done is actually work with the School-Based Health Alliance. That's the organization where all the school-based health clinics come together. And we made a playbook. That's sort of the way they put together information for their school-based health clinics. We worked with several school-based health clinics as well as young students, as well as teachers. And you can see the playbook has 4 sections. And it's sort of and it's very practical. What's the process? How do you start it? Some of the tools, examples from the field. So there are 2 school-based health clinics that have actually given a lot of information how they've done this and how it's working. And then additional healthcare transition resources where we have resources around school-based mental health, special ed, the kinds of things that you'd seen before in tools. So I'll just walk through this quickly. Next slide. You went ahead 1. There we go. Starting it here, as you can see, we talk about forming a team and getting the school support, deciding your improvement plan, and there's examples. Think about the implementation sort of workflow. How is it going to work in your school-based health clinic? How are you going to measure this to see if it's really effective? And then think about communicating it and advocating for other school systems within your system if you were the pilot, which is usually the case. Next slide. People were very interested in when you would use particular tools, and this is just letting people know what the tools were and who you might actually offer these tools to, from sort of the younger high school student to the older high school student. And you all are pretty familiar with many of these tools here. Next slide. So these are examples. As one from Connecticut's Community Health Center. This is a large network, and they've been working on this for several years. And then Michigan's Department of Health and Human Services partnered with a school-based health clinic and has put together, and they're sort of newer at it. So it's a nice example of a smaller and then a larger school system. Next slide. This is really some of the other resources, and this is where you would find a lot of our tools from Got Transition, as well as tools for other school settings. That's what I'm mentioning, mental health, as well as special education. And then some particular tools for the school-based health team. Next slide. So this is one of the 2 toolkits that we've developed over the past couple of months. And the first is an emergency prepared toolkit for young adults with intellectual and developmental disabilities for the primary care physician. So this was quite a challenge. Next slide. It was funded by the With Foundation. Next slide. And what did we do? We pulled together an advisory panel who you can see had representations, and they were true representatives of the large primary care physician associations here, because part of the job of doing this was having them bring it back to those associations. We also had self-advocates that were interviewed by Alyssa Ware from Family Voices, to get their needs. What do they think is most important in this process? You can see there were obviously self-advocates on the advisory panel as well, but you noted that it's you've got the American Academy of Family Physicians, nurse practitioners, American Academy of Pediatrics, American College of Physicians, and then some disability associations as well. So it was quite a group, and the idea here is, could we put something together that busy primary care physicians would consider? I think this is hard. This is a very big project, and we wanted to make it something that was potentially doable in bites. And I think that's the way you'll see it put together. I was interested when we first canvassed everybody, did the advocates or a lot of the self-advocates, most people didn't have this in place. And this was done after a year and a half of COVID. So it's interesting to me that even though that was a major issue and did sort of catch everybody by surprise, it really, hasn't really taken hold, though everybody said, oh my goodness, of course I should do this. So the next slide, I'll walk through this with you. So it has 2 tip sheets. One is for primary care teams, right? Though we're talking about primary care physicians, but it's a team. It's actually the nurse, it's whoever is working with the family. And one is for young adults and with intellectual and developmental disabilities and their parents. So this is really for young adults. That was the guidance from the WITH Foundation. So we're talking about young people over the age of 18 with intellectual and developmental disabilities. Now, I think the key thing here is that this disaster emergency plan is likely to be done over several in-person or telehealth appointments. I think the first thing that actually, when we had created it and then let it out to be tested in a variety of settings, everybody said, oh, that's just entirely too much to do in one visit. And the answer is, that's not the point here, is that you're going to do it over a period of time because there are multiple components to it. But it gives you a framework to think about with the family and the young adult. Next slide. So here is sort of what you'd think about with a primary care team. They wanted it really a stepwise approach to be put together. And first was to choose an emergency care plan for use in your practice. And you'll see we actually went through many of them and then vetted them with our committee, and they chose several that are what they thought were feasible, and I'll show them to you. Next was creating a medical summary. It was so interesting to me, though that's a big push in healthcare transition. It sort of took everybody by surprise. So we were glad that everybody thought that was an important piece to be part of this emergency preparedness plan. Then obviously reviewing key areas to include. I think the key issue here was also the legal issues, and then the wellness and self-care for both the young person as well as the caregiver as in the middle of all this. And then asking yourself, the physician, about communication assistance. How are you going to be communicating with this young person and family if there is such a disaster? Do you have a plan? Because obviously many people didn't know what to do because nobody was in the office when suddenly everything closed. So there was a lot of questions about that. Next slide. So choosing a disaster emergency care plan, you can see the ones that this group felt were the most helpful and the ones that are available in English and Spanish. In our toolkit, you can click through to them. They're all easily available if you look at our toolkit on the website. Next slide. Obviously, creating a medical summary. You all are very familiar with this. Once it's created, to obviously share it with the young adult and parents or support people, and add it to the disaster emergency care plan and the electronic care record portal. I can't tell you how many times people said actually it was hard for them to hang on to things, but if they could get to it electronically and then share it, that was a good way to do it. So to keep it very private. It can be put up on the portal, and a lot of people are finding that's helpful, irrespective of this emergency care plan. I've been doing that routinely for my patients so that they have it available. Next slide. So these are key areas to include. And the first question really to think about is, do you have a disaster emergency care plan? Now, I would say probably 90% of the time somebody's going to say no, but if they do, because some actually do, make sure that the copy you have is in the hands of the physician's office, and be sure, we're asking the physician to ask for it, and to take a look at it and be sure sort of the key areas are covered. And if no, then think about offering a template and have the family begin to look at it and think about over several appointments, slowly filling it out as you're going forward with it. And always asking, is it feasible for the young adult, the parent, or the support person who is going to actually implement this? And think about it as you go through it, because a lot of it's complicated, particularly when you're talking about many different disasters, whether it's flooding, whether it's fire, whether it's heat, whatever it is that's forcing people into an emergency situation. Next slide. So thinking about the legal issues, this well. Is there supported decision-making, power of attorney, guardianship documents? If they are, they should be a part of this plan. I can't tell you, I've reviewed a few and somehow that never makes it into it. I think it's very important that it's available so everybody understands the situation with this young person. And then, do you have a plan for self-care? Do you have a circle of support to help you in the time of disaster? Have you really talked to people about it so everybody knows that they're going to be potentially called upon to help you during this time? Next. And then obviously asking questions about communication system. These are asking yourself, the doctor should ask themselves. Do you understand and have you noted in the chart the communication needs of the young person with intellectual and developmental disabilities? This is something that was very prominent in the concerns of the self-advocates. And I think it's such an important point that it should be really upfront in the medical record. And then thinking for the physician how to maintain communications between your patients and your office when you're in an emergency situation. Next slide. Then there's a young adult tip sheet, which I'll walk through to get a visual of it. It was really developed almost by the self-advocates themselves as they had been working through the one for the primary care. It's written in plain language. It's meant to be used by young adults. And next slide, we can walk through what's there. Areas to consider, as you can see, it's for young adults, and the areas are tips about what should be in your disaster emergency plan, questions to think about, suggestions for your parent and support person, and sample disaster emergency care plans, which are the ones that are in the provider toolkit. Next slide. So do you have an emergency disaster plan? If no, ask your doctor about one you can use and bring it with you each time so you can slowly go through it. And then if yes, is it really up to date? Some people have put it together a while ago and would making sure it's up to date. Does your doctor have a copy? Do you have a paper copy available if anybody needs it? And is it part of the medical record? Is it easy to grab? Could you do this? I mean, I think these are very important things to, you have to really ask these questions, be explicit. This was a very important piece that the self-advocates pointed out. Next slide. What should be there? You can see here your current medical information, and how you get your medicines, equipment, first aid kit, batteries, chargers if you need them. What are some of the other supports you need? Next slide. And then having copies of these important documents insurance cards, prescriptions, medical information, and obviously your plans as well. Next slide. This is some of the disability sort of resource information, information on transportation support. How would you find these kinds of things? Local emergency numbers, just sort of doing this beforehand so you're fully aware of them when you're in the emergency a little bit here. I think the lists here that we have includes your local FEMA regional offices, which I think are important. You can see there's a tip here. Contact your local emergency resources, first responders, law enforcement, fire department, power companies, to receive emergency alert notifications. Let them know about your young adult's disability. If they're dependent on electricity, this is a very important thing to do so that they know their priority and any issues around lack of electricity or other utilities. Next slide. What should be in, there's some environmental things that you ought to think about. What else should you have quickly available? I'm thinking of all these people in California who are having to leave their homes in the face of these fires. I hope many of them have thought about this and think about some of these things. Where would you go for temporary shelters? If you're separated from your young adult, does he have information about that? If he or she has a difficulty with communication skills, obviously clothing and those kinds of things. Next slide. These are the legal issues that young people need to think about. What did they have? Did they have a support decision-making or power of attorney or guardianship document? They wanted to use these words, they being the self-advocates, even though some people may not know what they are. But clearly this could be gone over very carefully with somebody in the office. And obviously another key thing that happened with this particular pandemic was having your doctor put a letter saying your parent needs to be with you. I mean, there's a real issue of suddenly finding young people who had challenges with communication skills, who were admitted to hospitals. Families were not allowed in with them. Lots of things have been done since then that many hospitals are making special allowances. But right up front, having a letter saying that this young person needs that support person there when they're admitted, when they're over age 18, I think is a very important piece of information. And obviously, how do you contact your protection and advocacy systems if needed? Next slide. Obviously, who are the people that are going to help you here? I think it's important, for young people to really think through who they are and do they actually know? You might say, gee, I expect this person to help me, but if you've never discussed it, which I found, which is very interesting, when I say, well, great, does so-and-so know? Oh no, I've never spoke to them and I assume they will. I'm sure they will, but having them know is very important. And then obviously another big piece was when suddenly people were locked into their homes, how do they keep in touch with the friends that they have? Depression is a big issue in any emergency, and young people felt totally isolated. And so how are you going to keep in touch and thinking about that a little bit beforehand? Next slide. And then communication support. These are just questions to think about. Do you use assistive communication devices? What is your plan if you lose access? Do you need help? Whether it's your language situation. How do you reach your doctor during and after the emergency? Can you do it via phone or video? Do you have access to your records online? That's such an important component here. Encouraging people, hopefully their doctor's offices have electronic systems with portals or MyCharts or those kinds of things, and knowing how to access and use it. Next slide. This was such an important piece that came up over and over again. Wellness and self-care. What do you need to really keep your sort of on an even keel? And do you know what they are? Do you have a list of services and supports? Are there cultural traditions that help you, and to think about that, because it can come to the fore when you're a little bit distressed or under tremendous pressure. And obviously making sure you take something with you that'll help you. Headphones came up over and over again. And for particularly young people, whether it's sensory boxes or soothing things that families should put together for a young person in this kind of setting. And obviously, the caregivers are extremely important here. What options are available for their own self-care, and what are the things that really worsen your young person's stress, and what strategies. Thinking about them, writing them down, having them available, because people in this kind of difficult situation really at first are panicked. And so having something there, this is step 1, 2, 3, 4, this is what I can do, helps people get into the right mode and get control of the situation as much as you can. Next slide. And these are the sample disaster plans that people can look at. Now, are any of these in plain language? No, not a chance. It would be nice, but they are not. And but they're obviously for everybody to use, and nobody's expected to do it on their own. This is a team effort with the family front and center as they're thinking about all these kinds of things, and is done over weeks, if not months. Next slide. So now we'll go on to the last one here. Next slide. So why did this come up? It's so interesting that it didn't come up sooner. I'm part of lots of young adult groups, and one day somebody said, it would be so nice if I could get both my pediatric and new adult provider somehow on the phone together, and I'm there so I know I can ask questions and really understand the information that's going back and forth. And I thought, well, of course. Now, I was already 6 months into completely converting my practice to telehealth. And I think all of us have known that care coordination is extremely well done via telehealth or electronic means. So why not do a warm handoff this way? So it was sort of a little bit of a no-brainer as you sat there, and then it became saying, well, has anybody done it? And I sort of put out the call, and it turned out that in the middle of this, we put it as part of a value-based payment pilot going on in the District of Columbia. We just added it as one of the things that were going to be done and paid for in that value-based payment. And that Children's Hospital of Philadelphia was at the same time beginning to put it together. It was very interesting. It was sort of both. When I emailed my colleagues there, they said, oh, we were just beginning to put it together. I said, okay, there you go. We need to get together, get a committee together, and begin to put together just something to give people a guide when they're beginning to think about it. So it obviously offers a shared communication that strengthens the continuity of care. And I think that's really helpful here. It's an anxiety-provoking time to leave one provider that you've known for a long time and go to a new one. There's a lot of anxiety, and all the feedback I've ever gotten is that completely helped with that sort of anxiety and improve the comfort and confidence of both the young adult and the parent caregiver with their new clinician. And it allows the young person is front and center here, and their family if they want them to be on this call, because most of the time these young people are over the age of 18. And it gives them a chance to talk about what worries them or what they want to let their new provider know. I think the key thing here is this is not the new adult visit, right? This is a almost a meet and greet a process here. Next slide. So it has 2 tip sheets as a part of it. One is for the primary care teams with steps to follow to assist their parents and young adult to join the telehealth visit. It gives you sample content. And then one is for young adults and their parents that you can let them know sort of what this is about. As I say, it was developed with input from providers at CHOP and others. It was reviewed by many and reviewed by young adults and parents. Next slide. So on the telehealth visit, there's a piece before the visit. There are some things that make it much easier for this to go more smoothly. One is to sort of share this welcome letter. Now, this welcome letter is really just something that we encourage practices to do in the transition process. It's welcoming young people into their practice, has some frequently asked questions, and lets them know about some very obvious things like appointments, if you miss them, those kinds of things. So having that and sending it to the young person and family before gives them an idea of the practice and answers some of the questions fairly quickly. The medical summary should go between the pediatric to the adult provider. So there's a lot of information that's already in the hands of the new provider. And obviously this is something that would be in the hands of the young person and family as well. And then talking about these confidentiality issues. Are there decision-making supports that need to be part of it? Or does the young person want, if there aren't and they're making their own decisions, do they want their parent there or they want to be on their own? And sort of settling that beforehand, I think, is important. Now, then there's the sort of during the joint visit, we actually sent you a copy of this, sort of it says who is going to be at the visit, lets people know it's both somebody from the pediatric office, somebody from the adult office, the young person, and perhaps their parent support person. And sort of goals. What are the goals of this? So everybody has them clear. Obviously, the most important one is having the young adult have a opportunity to meet and engage with the new clinician, ensure this warm handoff, promote the young adult's involvement in the conversation, and then clarifying next steps, which has been very helpful for families. And then obviously timing. This is up to the 2 practices. And this setting here is important to make sure that people know how long it's going to be. Next slide. So then there's the actual suggested agenda. Of course, anybody can do anything they want during this time. But when you talk to young adults and families, it was very important that the pediatrician sort of take the lead here. They're the people that have been really taking care of this young adult and, introduce everybody, Johnny, here is Dr. So-and-so, or however people want to be talk about. And I think the other key thing is that the pediatrician should assure that the adult clinician has received a copy of their medical records. This makes everybody feel better. And, I talk a little bit, the pediatrician, about please do feel free to contact us about the bulk of, if you have questions or a problem, but really the bulk of your care now will be transferred to this primary care physician. If there are a lot of physicians involved, there are going to be other transitions to other subspecialists talking about that a little bit. So everybody gets a sense of the big picture here. And what happens? Now, maybe the new adult visit isn't for 3 or 4 weeks, or maybe it's longer. What do? Well, of course, the pediatrician should be saying, contact our office until you get to that first visit. And then I think the key thing here is having the young person have a chance to, ask some questions. And in the part of the toolkit, we'll show you some of the questions that the young adults came up with. And then the adult clinician gets a really chance to, confirm a lot of the things and tell about, the number one question people ask, I've been on a lot of these, is where do I park? When I get to the adults clinician's office. Those kinds of things are very helpful. And, being clarity about, how do I contact the office and those kinds of things. Now there's a script if the office really felt that the adult office was a little unclear. That's part of it. There can be a second segment here. It's turned out that maybe you blocked off 30 or 40 minutes and the young adult is pretty straightforward. You do all this and you've got 20 minutes off and the young adult says, see ya. And then the two clinicians have a chance to really talk it through, saying in that first visit, what are the things that are left that weren't done in your last visit? What are the things I need to pay attention to? And if the young person hasn't really had, didn't take the opportunity to say what they wanted to tell their new provider, other than their medical, I think that's really important. I'm a great whatever drawer or music person, to get that information from the pediatric provider. This is all about trying to engage that young adult in that first visit. Next slide. So then there's a quick one-pager for the young adult that really sort of goes through a lot of this. Who will be there? What will happen? It's pretty straightforward. What are some questions? I'll show some of the ones they came up with. What you might want to tell your new doctor, and then after the visit, and then there's some resources here. Next slide. So these are some of the ones that came up. You can see, how do I get to the office? What should I bring? Is the office accessible? Do you have an up-to-date medical summary? If that was not actually said by the pediatric provider, this is sort of confirming, because I think this is very important. That came up most from the parents that were involved in creating this. How do I schedule a visit? Often that scheduling of that visit happens right on the joint telehealth. They come right in and saying, we have these 3 dates open, and on a couple they said, because their young person was pretty disabled, that they only could get there after 10 in the morning. So they knew right off the bat that they needed to find an appointment that was later in the day. And then, how do I contact if I have urgent healthcare need? And will you communicate? And obviously they would, but they would only with the approval of the young person or the legal person that's has that ability. And they always ask how often I need to see you. And when I'm on the adult side of this, I always say, well, if you're taking good care of your health and everything is going well, it'll be less than if somehow things aren't going well or your illness has a flare or something. And this comes up. We have some pretty tech savvy young people, so I want to a little bit know about the technology, though most didn't really care about it. All right. And then some questions to ask your new doctor if you want your parents to be a part of the visits or your caregivers, and how they communicate with them, etc. Next slide. And then what do you want to tell your new doctor? Something, having them think about it. Is there something about their medical history or something you particularly enjoy? Maybe you're particularly worried about. We had a person with autism who was extremely frightened of blood tests and wanted to be clear about that and what could be done to make it easier. And then obviously, who else you'd like to be involved? Is there somebody that you want to have access to your records? And then obviously after the visit, working with your pediatric office to get a new appointment, or a lot of times that happened right on the call. It was quite remarkable how quickly. And one of the adult providers that we worked with in our pilot actually had behavioral health in the office. They were, and so a family who had been trying to get behavioral health on the pediatric side for over a year got the appointment right off the bat when they were getting their adult provider appointment. So things get streamlined fairly quickly when everybody is on the telehealth call together. Next. So I wanted to give you an idea. We did a study. It's small, though we've continued and got a lot more. But we were doing a value-based payment study in specialty in Medicaid managed care. It was for young people with intellectual and developmental disabilities. That was what this was funded for. And we did it with local pediatric and adult healthcare providers. And they were doing just the sort of the transfer process, the final visit, pediatric medical summary, the joint visit, and the initial adult visit. And we then asked about feasibility. We wanted to let's say, what did you think from the young adults and the families, as well as interviews with participating healthcare providers? Because if everybody thought it wasn't worthwhile, then, fine. We didn't need to work with it so much, but it was a resounding success. In this particular pilot, there were 6, but we've gone on and done 30 or so. I've not had a young person or family say, gee, it wasn't helpful. I've had people not want it because they didn't feel that their situation was that complicated. It's clearly meant for young people and their families who have either complex medical issues or complex behavioral or intellectual developmental disabilities. It's that more complex situation, I think, where this plays a much more important role. All the physicians thought it was terrific. The real issue here is 2 things. One is payment, as you would imagine, and the second is scheduling. Since this is a pilot, we were doing it ad hoc, but in the larger systems that are now employing this regularly, they just, like anything, once a month have 2 telehealth visits that are in the schedules way beforehand. If it's not going to be used, it's completely, it's just taken away and rescheduled for another kind of patient. So it's become much easier when you're looking ahead. A lot of systems now are trying to do joint visits, have been doing it for a while, but COVID totally interrupted that. And with this coming as available, now they're doing this instead of that, which is working quite well. In these big systems, they're willing to pay for the time. Right now, we tried hard to go through the AMA, RUC, and so forth. They turned us down. Doesn't mean the AAP and the ACP and GOT Transition are going to give up. We just got to retool it and rethink about getting it. There are many components of it that can be billed, so it's not completely, you can't bill it at all. It depends on whether you're doing chronic care and a variety of things around the young person. Next slide. So I wanted to show you the video. We've got just enough time to do this, I think, that we put together about joint telehealth with CT CASA and funded by Family Voices. So, do you want to play that quickly? You want to go back to, there you go.
The main person making decisions about your health. For many youth and young adults, this can be a challenging process. HCT is not a single event. It's a process that usually takes several years to accomplish. One major part of HCT is learning to manage your own health and healthcare. For those who see a pediatrician, HCT also means moving from your pediatrician to an adult doctor. This usually happens between the ages of 18 and 22. Turning 18 also means your doctor can only legally talk to you about your health. Your health information and medical records will be kept confidential, but you can decide if you want your parents to see your records or be in the doctor's appointment with you. In our new virtual world full of telehealth doctor appointments, how can we make the transition to adult healthcare smoother? Having a joint telehealth visit could be a good place to start, especially if you have a chronic condition. This is a virtual meet and greet appointment that can help prepare you for your transition to a new adult doctor. Let's walk through how a joint telehealth visit might work. A joint telehealth visit includes you, your pediatrician, and new adult doctor, as well as your parent or caregiver if you wish. During the joint telehealth visit, your pediatric doctor will introduce you to your new doctor. Your pediatric doctor will also share some important medical information about you with your new adult doctor. The visit is a chance for you to meet with your new doctor before you go to your first medical appointment. During the joint telehealth visit, you can also ask your new doctor questions about concerns you have. It can be a good idea to prep some questions beforehand. So, here are some examples of questions you may ask.
How do I get to your office? What should I bring? Is your office accessible? Do you have my up-to-date medical summary? How do I schedule an appointment? How do I reach you if I have questions or a health emergency? Can my caregiver join for some or all of this telehealth visit? What forms do you need so you can communicate with my caregiver? The joint telehealth visit can also be a great opportunity for your new adult doctor to start to get to know you. Feel free to share some fun or important information about yourself that you want your new doctor to know before your first visit with them. Here are some examples that you could share with your new doctor. Something you enjoy, like sports or drawing. Something about your medical history. Something about your preferred communication style and capabilities. Something you are worried about at the new office, like blood tests. Who else would you like to be involved in your healthcare, such as your parents/caregivers? After this joint telehealth visit, work with your new adult doctor's office to set up your first appointment with your new adult doctor. So why is the joint telehealth visit a helpful part of your transition to an adult doctor? A joint telehealth visit is a chance to get to know your new doctor, ask questions about their office and how it works, build trust with your new adult doctor, share your story, self-advocate for your health needs.
Healthcare transition is all about taking charge of your health and feeling empowered. So go for it. Speak up during your doctor's appointments, and if you need your parent or caregiver's help, ask them. It is important to feel comfortable during this process. And when you advocate for yourself, the transition to adult care will make the change easier and an overall better experience. Got Transition is a program of the National Alliance to Advance Adolescent Health and is funded through a cooperative agreement from the Federal Maternal and Child Health Bureau, Health Resources and Services Administration. This program is supported by the Health Resources and Services Administration, HRSA, of the U.S. Department of Health and Human Services, HHS, as part of an award totaling $1 million, with 0% financed with non-governmental sources. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by HRSA, HHS, or the U.S. government. For more information, please visit hrsa.gov.
Oh, don't you love those final things? We had to put those in. We had no choice. Makes my day every time I hear it. Now we'll just quickly finish up. A lot of people have questions about how to customize healthcare transition tools. It's very easy. Next slide. Tim, thanks. You're fantastic. So you just go to our website, and then you're going to really go over, hover over the 6 core elements and click on the customizable packages, as you can see. Next slide. And then you're going to, there immediately is going to be a request to fill out a customizable version. What is that? We just would love to know who you are and what you plan to do with them. We have to report this back to the federal government. So it's not onerous or anything. And we also ask, can we get in touch with you in 6 months to see how they went? and then we follow up. So we're following over the many years how many people have gotten customizable tools and what they've done with them. And so after you fill that out, you'll select the transitioning youth and young adults, whichever one. This is the pediatric package. You'll select that, and whether you want an English or Spanish. Next slide. And you'll see here, open the download zip file and open the tool that you want. Again, next slide. And up will come pretty much, it's like a PowerPoint file. So this makes it very easy. You can swap out your logos, colors, you can edit, delete, or move questions around. Legally, you need at the bottom, if you do make a lot of changes, to put this attribution statement. That's part of this. You know, you don't have to memorize this at all, but this is what you need to add at the bottom. The 6 core elements are, you know, copyright, and this version has been modified and is used with permission. We just need to give people permission to do this. Next slide. So that's it. I'm finishing just on time here. I really appreciate the opportunity to show you these tools. Love to hear your feedback or any questions you have, but we're excited about it. All of them have been clicked on a lot, particularly the telehealth one is one of our newest ones, and a lot of people are extremely interested in it. So I will turn it back to Tim, and thank